Before we get to the clinical data, I want to crystallize what Laser-Lok actually does because it is three things at once and they reinforce each other. Three pillars with one unified goal of peri-implant stability. Each pillar enables the next. Pillar 1 inhibits epithelial downgrowth. The connective tissue creates a physical wall so epithelium cannot migrate apically because territory is already occupied. Pillar 2 establishes connective tissue attachment. This is the only implant surface in the world with clinical evidence of load-bearing connective tissue attachment. Collagen fibers attach titanium perpendicularly. Pillar 3 preserves the crestal bone. By creating a protective biologic seal, the underlying crestal bone is shielded from microbial invasion, inflammation, and resorption. This is the mechanism, but what does the crestal bone actually look like at 1 year and 3 years? What are the real numbers from real patients? 0.59 millimeters. Histology proves the mechanism, but clinical proof demonstrates the outcome. Let me ask you something. What number comes to the mind when I say acceptable bone loss around a dental implant? You already know the number 1.5 to 2 millimeters in the first year, then 0.2 millimeters for every subsequent year. That is what we were taught, that is what the textbooks say, that is what we have accepted. But here is the question we stopped asking. Why is that acceptable? It is because when a machined collar fails to seal, the body resorbs bone every time predictably, and we call it that biological width instead of what it really is, a biological compromise we learn to live with. Now take a look at these two implants placed at the same point of time in the same patient population with same loading conditions. One on the left and one on the right. Left side, you have seen this 1,000 times. Bone loss exposed the threads. That familiar dark gap under the collar. And the right side is something different. The bone is right where it started, with no gaps and no threads exposed. A crest that looks like the day it was placed. At 37 months post loading, the conventional implant gave us what we expected 1.5 to 2 millimeters of bone loss. But what about the Laser-Lok implant? Only 0.59 millimeters. That is not less bone loss, that is a different category of stability. So, here is what I want you to sit with for a moment. If 1.5 to 2 millimeter was acceptable only because we had no alternative, what happens when an alternative exists? Does acceptable suddenly becomes unacceptable? Because that is exactly what the data is asking us to reconsider. How Laser-Lok does this? Not by magic, but by geometry of contact guidance achieved through microchannels. A seal that actually seals. But first, just remember this number of 0.59 millimeters because that is not just a number, that is 37 months of proof that we don't have to compromise anymore. The bone numbers are extraordinary, but is this technology actually proven over years of clinical use, or is this still emerging? Who else is saying this besides the company? Laser-Lok is validated by a decade of research and clinical use. Remember, validation does not happen overnight. It is earned study by study, year by year. Human histology confirms a true perpendicular connective tissue attachment, not a parallel scar tissue as in traditional implants, but a functional biologic seal that preserves bone and inhibits apical epithelial migration. Multiple independent university studies validate crystal bone preservation and soft tissue stability, reproduced across different research centers. Animal studies demonstrate resistance to peri-implantitis induction compared to traditional surfaces, a critical advantage for long-term health. Over 15 years of clinical use has proven the clinical performance of Laser-Lok implants across a wide range of clinical applications and patient population. Not a single study, not a single claim. A decade of evidence, Laser-Lok implant colors are validated by science and proven in practice. Dr. Michael Picos is not paid to say nice things about surfaces. He is one of the most rigorous clinicians in implant surgery. When a clinician of that caliber uses the words new and effective, I pay attention. Peer endorsement from a credible third party is more powerful than any data slide. Science is there, data is there, the clinical track record is there. What does patient actually see? What does the practice actually deliver at the end of this? A stable biologic seal does not just protect bone, it creates something you can see, something your family sees, something that is reflected in the photos you share. The stable peri-implant soft tissue margin, healthy attached keratinized tissue, is the direct reflection of the stable transmucosal seal achieved through the Laser-Lok technology. The stable biologic seal translates directly to predictable and beautiful soft tissue outcomes. This is their direct translation from histology to aesthetics. Compare this stable biologic seal to a compromised seal that observes inflammation, recession, and unpredictable margins. How does everything connect? Is there a simple mental model I can use to explain this to a colleague? For decades, the peri-implant interface has been managed as a zone of compromise. But what if we stopped managing compromise and started engineering stability? Laser-Lok microtopography preserves crystal bone and soft tissue, establishes organized perpendicular connective tissue attachment, creates a true biologic seal, and delivers a predictable and long term success. Laser-Lok is not an incremental improvement, it is a fundamental shift in how we manage the critical zone around dental implants. By working with the body to create a natural tissue seal, Laser-Lok provides the foundation for a new level of clinical predictability and confidence that is redefining the standard one interface at a time. Here is what I want to leave you with. Every generation of clinicians inherits a set of problems they didn't create, but we inherited some of crystal bone loss is normal. That assumption protected us from having to solve it. Laser-Lok solved it, and our job is now simply to use it. Question for each of us is not whether the biology works. The science has answered that. The question is, are we ready to hold ourselves to higher standard? I believe we are.